হ্যালো
দেখো তো তোমার ফেসবুকে
সবুজ
নিয়ে না হ্যাঁ দেখতে পারতেছে সবাই শোনাও
ঠিক আছে
ঠিক আছে এখন লেকচার দাও
থ্যাংক ইউ বাবা থ্যাংক ইউ আমি কোথাও সঙ্গে কথা বলতে পারবো
হ্যাঁ তুমি পুরা লাইভ তুমি যেটা বলবা সেটাই তো ক্যামেরাতে নিবে লাইভে নিবে
ওদের কথা শুনতে পাবো তো
আমার মনে হয় না ডোন্ট থিঙ্ক তুমি ওদের কথা শুনতে পারবা তোমাকে ভলিউম আপ করে দিলাম
তো এরা যে কোনো কোশ্চেন করে কোশ্চেন পাবো কোথায় আমি
কোয়েশ্চেন
এখানে আসবে
এখানে এখানে ইয়া সবুজ ভাইকে বলে এখানে দিতে সব কোয়েশ্চেন তুমি এখান থেকে কন্ট্রোল করো সব
আচ্ছা রাখো এখানে কি দিচ্ছে কি আমি মে স্টার্ট না
You're already started, yeah.
আমি ডোন্ট গো নাও
আমি এখন দাঁড়াই প্রথম খুলে
হ্যালো ক্যান ইউ হিয়ার মি তোমরা কি আমাকে শুনতে পাচ্ছ হ্যালো হ্যালো তোমরা শুনতে পাচ্ছ আমাকে হ্যালো
6 জন ভিউয়ার্স এই যে লাইভ এই যে 7 জন ভিউয়ার্স
ওকে ওকে ইয়েস স্যার বলছে এখানে
আচ্ছা
না কারেক্ট শুরু করে দেবো হ্যালো
ওরা তোমাকে শুনতে পাচ্ছে কিন্তু ওরা তোমাকে কিছু বলতে পারবে না
ও এটা নাকি
আর আমার মনে হয় না বা কমেন্ট করা যাওয়ার কথা আমার ফোন নিয়ে আসো আমার ফোন থেকে তোমার এদিকে ঢুকতে পারিনি
দেখি এবার কি বলো তো
সব রেকর্ড হচ্ছে তো
but I'm not getting any response from them এরা কি আমার মেসেজ পাইতেছে
সবুজ ভাই পাওয়ার কথা ডক্টর সবুজ
কি লেখা
কি বলছে ইয়েস স্যার তুমি পাচ্ছ সব
Okay. Okay, so thank you very much for giving me a chance to meet with you over the internet and cell phone, and my son also helped me to put everything in order. So let's start our class now. Okay. Yes. This is the model of brain. We'll go through the anatomy of the brain, what you will be asked in the Viva board examination. So I'm staying in the United States of America, so I may not speak always in Bengali, so please consider my situation. So let us start. What you will do in front of the Viva board, you will hold the brain specimen in anatomical position, then you will describe the anatomical position, like what is the superomedial border, then what is the superlateral surface is where, then we'll go through the central sulcus, the lateral sulcus, and we need to identify the major sulcus and major gyrus. So then the second question will come, what are the lobes of the brain? We must know the lobes of the brain. We have the frontal lobe, we have the parietal lobe, we have the occipital lobe. Then how can you draw the occipital lobe? Our answer is that we have the parieto-occipital sulcus here, and that is about 5 centimeter above the occipital pole here, and we have the pre-occipital notch that is again on the lateral border, the infralateral border, 5 centimeter. We'll connect the parieto-occipital sulcus to the pre-occipital notch, then we'll get the occipital lobe. Okay, so again find out the frontal lobe that is in front of the central sulcus. We have the parietal lobe behind the central sulcus. Then we have the occipital lobe. Okay, we have the temporal lobe that is below the lateral sulcus here. This is the temporal lobe. So when you will hold the brain, you will hold with confidence. So you need to practice as much as you can in front of your friends, so that in the exam hall you may not be shaky. Okay, we got the border, supraumbilical border, we got the infralateral border, we got the supralateral surface here. We must identify the major sulcus, major gyrus. Okay, lobe, surface, border, pole. What is pole? Pole is the pointed part of the brain. Suppose this is the frontal pole, this is the occipital pole. Okay, this is the temporal pole. We must know that part. Then you will get some terminology like that of what is prosencephalon, what is telencephalon, okay, what is mesencephalon, what is rhombencephalon. So you need to know the terminology from the very beginning, so that in the exam hall you may very much spontaneous to answer that questions. Okay, we got that. Now what is sulcus? Sulcus is the depression. What is gyrus? Gyrus are the elevation. Why we have sulcus and gyrus? We have sulcus and gyrus. Idea is to accommodate neurons. If we have more infolding, we will have more neuron to be accommodated in a small area. So that's why we have sulcus and gyrus. It is singular term. It is in plural term the sulci and the gyri. Okay, or sulci. Okay, whatever you say. Then we'll go to the medial surface. Okay, so again I will request everyone, before going to the viva, please go to your anatomy lab, hold the brain as much as you can by your own hand and practice with your friend. Otherwise in the exam hall you will be nervous. There is no room for nervousness. Okay, let's start. This is our medial surface. Okay, then what are the important structure in the medial surface? We have the corpus callosum. What is corpus callosum? Corpus callosum is the great commissural fiber. What is commissural fiber? Commissural fiber connect the two cerebral hemisphere. So this is the corpus callosum. Then what are the parts of corpus callosum? We must know. We have the rostrum, genu, then body of the corpus callosum. Then we have the splenium, S-P-E-L-I-N-U-M. Okay, we have to find out that. So parts of the corpus callosum. Then what is this area just below the corpus callosum? We have the septum pellucidum that forms the medial boundary of the lateral ventricle. Then below that we will get this white stuff is the septum pellucidum, and you will get septum pellucidum fornix. You will get the fornix. Okay. Then we will get the choroid plexus here. Okay, let me put it here. So this is the choroid plexus. Okay, what is choroid plexus? Choroid plexus is very important structure that is present in the lateral ventricle, in the third ventricle, and in the fourth ventricle. Choroid plexus is formed of what? Capillaries, and what? The pia mater, and what? And the ependymal cell. Okay, what is the purpose of the choroid plexus? Choroid plexus produces the cerebrospinal fluid. Then your teacher will push you towards the circulation of cerebrospinal fluid. How it is formed? Yes, it is formed in the ventricles by the choroid plexus. Then from lateral ventricle, how it enters the third ventricle? Through the interventricular foramina of Monro. Okay, it should be here in the this is a model, so you'll pick up the interventricular foramina of Monro. Okay, very good. Then what is the third ventricle? Third ventricle is between diencephalon. What is diencephalon? Diencephalon is formed by the thalamus and the hypothalamus. We have other part like that of pituitary stalk with the tuber cenarum. We have the mammillary body. So this part is the diencephalon. This part is the diencephalon. This is the thalamus. We have one connection between two thalamus. That is called interthalamic adhesion. Then your examiner will ask you, what is the purpose of thalamus? Thalamus is the major sensory relay station. Okay, thalamus is the major sensory relay station, and all sensations should go through the thalamus with the exception of the olfaction. Olfaction has indirect connection, but olfaction go to the telencephalon without relaying in the thalamus, but all other sensation should go through the thalamus. Then we have the hypothalamus, small structure but controls all the system of our body. That include temperature regulation, appetite. Also it releases the releasing factor that controls endocrine system, that controls also the sympathetic system. Okay, so that is very important. It controls autonomic system. Yes, so hypothalamus, small structure but controls all the system. It is also a part of the limbic system. Okay, we got that. The thalamus, this thalamus, this is, let me try here, thalamus, this is the hypothalamus, this is the pituitary stalk, this is the pituitary gland. Okay, in the examiner will ask you, identify the pituitary gland, small pituitary gland or master gland. Okay, where it is located? In the pituitary fossa. Okay, where is the pituitary fossa? In the sella turcica of the sphenoid bone. Okay, what are the parts of pituitary gland? We have two parts, adenohypophysis and the neurohypophysis. Then question come, what hormones are released from the posterior pituitary? Answer should be what? Antidiuretic hormone and what? Antidiuretic hormone and the oxytocin. What is another name of antidiuretic hormone? That is the vasopressin. It also increases blood pressure. Okay, it works where the antidiuretic hormone work? It works on the distal convoluted tubule of the kidney. Okay, also in the collecting ducts. We have to know that part. Okay, so the antidiuretic hormone oxytocin, where they are produced? Are they produced in the posterior pituitary gland? No, they are not produced in the posterior pituitary gland. Antidiuretic hormone and the oxytocin are produced in the hypothalamus. Which nucleus of the hypothalamus? Supraoptic nucleus for the antidiuretic hormone, paraventricular nucleus for the oxytocin. So these are the hormones produced in the hypothalamus. They are stored in the posterior pituitary. Okay, we got that. Okay, now you have to identify some major gyrus like cingulate gyrus. Okay, this is over the corpus callosum, cingulate gyrus. Below that, above the corpus callosum, we have the callosal sulcus. Okay, very good. If you go to the posterior part in your living body, you may get the pineal body. Okay, pineal body. So what is the purpose of pineal body? What is its function? Pineal body produces a hormone called what? Melatonin. And pineal gland is essential for reproductive function, plus it also important for the circadian rhythm. We sleep at the daytime, we sleep in the night time, we stay awake in the daytime. So that is controlled by melatonin plus the suprachiasmatic nucleus of the hypothalamus. Both work together to keep us awake in the daytime, sleep in the night time. Okay, we got that. Okay, so come to here, we have to identify the parieto-occipital sulcus, and very important, the calcarine sulcus, not good in this model, calcarine sulcus. Calcarine sulcus also extend to the superlateral surface posterior aspect. Calcarine sulcus, what is the area number of calcarine sulcus? Area number 17. What are the associated area? Area number what? 18 and 19. Okay, we got that. So we got thalamus, and we go to the midbrain. Important to us to identify the midbrain area. This is the midbrain. This is the pons. This is the medulla oblongata. Identify that. Then we have the pyramid. We have the olive. Okay, olive, pyramid. What nerve comes out between the olive and pyramid? We have to find out that. That is the hypoglossal nerve. Okay. So again, the nerve is important to us. The cranial nerve. The examiner may go to the cranial nerve very frequently. Suppose, what is this? This is the olfactory bulb here. Okay, olfactory tract, then olfactory stira. Okay, this is olfactory bulb. It receives the olfactory receptors. Where is the olfactory receptors? Olfactory receptors are present inside the nose. Which part of the nose? Upper 1/3 of the nasal cavity. We have the olfactory receptors. What are the olfactory receptors? Are they neuron? Yes, they are neuron. What type of neuron? They are bipolar neurons. Okay. Then how the bipolar neuron enters the cranial cavity to reach the olfactory bulb area? It enters the cranial cavity through the cribriform plate of ethmoid bone. Okay, we have a lot of opening in the cribriform plate of ethmoid bone for the passage of the olfactory nerves. Okay, we got that. Okay, then regarding sulcus, some of your teacher like that word. What are the limiting sulcus? What are the axial sulcus? What are the opercular sulcus? What are the secondary sulcus? So please be prepared for that, so that you can answer in the exam hall nicely. Okay, so suppose limiting sulcus between the precentral gyrus and postcentral gyrus, will get the limiting sulcus. Okay, we have to go opercular sulcus, will get the lunate sulcus here. Okay, it will be better in your exact brain. Okay, we got that. Okay, so then teacher like few things. This is the frontal surface. Inferior surface is two part. One is the frontal area here, another one is the tentorial area here. Okay, frontal area, we have the, again this is the gyrus rectus, medial part gyrus rectus, then one H-shaped sulcus, the orbital sulcus. We have to know that part. And this is the superciliary border, the infralateral border. This is the superciliary border. We have to identify that in the exam. Okay, very good. Okay, so now go to the midbrain again. What is tectum? What is your tectum? Tectum is behind the cerebral aqueduct. What is the cerebral aqueduct? This is the cerebral aqueduct. Cerebral aqueduct connects what? Cerebral aqueduct connects the, okay, so the cerebral aqueduct connects the third ventricle to the fourth ventricle. Where is my third ventricle? How many third ventricle we have? One. Because third ventricle is the slit between the diencephalon. Okay, this is very much slit like my two hands coming together. That is the third ventricle. Then we have two lateral ventricle, one third ventricle, one fourth ventricle. From fourth ventricle, how CSF goes? With the central canal of spinal cord. On the roof we have three opening, foramina of Magendie, foramina of Luschka. Then where CSF goes? CSF goes to the subarachnoid space. From subarachnoid space, where does it goes? The CSF. CSF mostly open into the superior sagittal sinus. How? By means of the arachnoid villi or arachnoid granulation. Okay, so that is most common site of absorption. Other dural venous sinuses, they also absorb, but mostly it is in the superior sagittal sinus. Okay, we must know that part. So in your exam hall, you may have section brain. Okay, you may get that. So please be oriented to the section. They make a section, a horizontal section of the brain, and you must identify the part of the basal ganglia. When you get the basal ganglia, they will ask you what are the components of the basal ganglia. Caudate nucleus, lentiform nucleus, corpus stratum. Okay, so we have the putamen, globus pallidus, we have the claustrum, amygdaloid body. You need to identify especially the big one like the caudate nucleus, lentiform nucleus. Then you have to identify the what? The internal capsule between what? Where they are located. What are the components of the internal capsule? That is very important to us. You have to show it because you will not get only this type of specimen. You will get section. Okay. You may also get section of the midbrain. If you get a section of the midbrain, what structure you will get? You will get the tectum cerebral aqueduct. Here is the cerebral aqueduct. Okay. Then we will get the tegmentum. Then we will get the crus cerebri, and in between them you will get the substantia nigra. What is the clinical importance of substantia nigra? Substantia nigra is very important. Substantia nigra produces a neurotransmitter. What is that? That is the dopamine, and that dopamine is essential for our movement. Without dopamine, what disease you will face? That is the Parkinsonism. Without dopamine in the older person, it is very common. Okay, we have problem in the caudate nucleus of the basal ganglia. What is the disease due to damage to the caudate nucleus of the basal ganglia? Answer should be a lot of disease may happen, especially the Huntington disease or Huntington disease, whatever you say. Okay, that may happen due to damage to the caudate nucleus. Our putamen, globus pallidus may be affected by some type of copper metabolic problem. Okay, it is called hepatolenticular degeneration or Wilson disease. Okay, so we got the basal ganglia, internal capsule, cerebral aqueduct. Okay, and what are the component of cerebral peduncle? Okay, if you have gone through that part, then what are the boundaries of the interpeduncular fossa? Very important. Interpeduncular fossa extend from where to where? What is optic chiasm? Optic chiasm is the junction between two optic nerve. Some fiber crosses, some nasal fiber, some fiber don't cross. Okay, so if I have a pituitary tumor, what will happen? I will have compression on the optic chiasm. What will happen? Will develop bitemporal hemianopia or anopsia. Both are correct. Okay, so that will develop due to pituitary tumor. Okay, we have gone through that part. We must know. Let's start again. Then you have section of the brain. What is white matter? What is gray matter? Okay, gray matter contains the cell body. Gray matter contains the blood. Gray matter is more vascular. It also contains neuroglia. Okay, neuroglia is present both in white matter, gray matter, but the cell body is present in the gray matter. Okay, so what is present in the white matter? In the white matter, you will get the axon. Why it is white? Because it is myelinated. Now question come. Okay, what cell causes myelination in the central nervous system? What is that? Neuroglia. Answer should be oligodendroglia. Okay, that causes myelination in the central nervous system around the axon. Then what cell causes myelination in the peripheral nervous system? Answer should be Schwann cell. So Schwann cell and the and the oligodendroglia. Oligodendroglia for the central nervous system, myelination, Schwann cell for myelination of the peripheral nervous system. Okay, then again we must identify the brain stem. If you identify brain stem pons, then in the pons you will get the fifth cranial nerve, the trigeminal nerve. What are the component? Bigger component is the sensory components, little bit smaller is the motor component. Now come motor component, trigeminal nerve. What is motor innervation? Trigeminal nerve has three divisions: the ophthalmic division, the maxillary division, and the mandibular division. Sensation here, including upper eyelid. Maxillary division here, mandibular division here. Sensation. Okay, what is motor? Motor is done by the mandibular component of the trigeminal nerve. Okay, what? Hello, can you hear me again? Okay, so some interruption here. I don't know. I'm not good in computer. My son actually helped me. Okay, very good. So we have the motor component. It supplies the muscles of mastication. What are the muscles of mastication? Lateral pterygoid, medial pterygoid, temporalis, masseter muscle. Okay, these are the what other muscles are getting innervation from the mandibular nerve, like the mylohyoid muscle, anterior belly of the digastric muscle, the muscle inside the middle ear cavity will get some muscle there, the tensor tympani muscle. Okay, so these are the muscles innervated by the mandibular division of trigeminal nerve. We must identify the trigeminal nerve. Okay, we got that. Now blood supply of the brain. You must show the blood supply of the brain. Where is your anterior cerebral artery? It should be here. Okay, what is the blood supply to the occipital lobe? It should be the posterior cerebral artery. What is the blood supply of the inferior temporal gyrus? Answer should be the posterior cerebral artery. Other part, blood supply is what? Blood supply is by means of the middle cerebral artery. Okay, except the supramiddle border around 1 or 2 finger area supplied by the anterior cerebral artery. So we must know the components of circle of Willis. Okay, how circle of Willis is formed. Vertebral artery, how many vertebral arteries? 2. They are branches of what? From the subclavian artery. They unite to form what? The basilar artery. How many basilar artery you have? Only one. Where it is located? Located in front of the pons. Where? In the basilar fossa. Okay, then it will split into posterior cerebral artery. We'll also get internal carotid artery. Internal carotid artery has division: anterior cerebral artery, middle cerebral artery. We have anterior communicating artery, posterior communicating artery. Okay, so we'll get the circle of Willis and this division. Okay, we got that. Now some type of question some teacher like, what is, we have already discussed the white matter, gray matter. What is nucleus? Collection of neuron in the central nervous system. Is it always the answer? Basal ganglia. Basal ganglia should be called basal nuclei, but a lot of books says basal ganglion. Okay, but ganglion is the collection of neuron outside the central nervous system in the peripheral nervous system. Okay, we got that. We got the nucleus. Okay, then we'll go a term. If you are good enough, you must answer what is blood-brain barrier. What structure form blood-brain barrier? The endothelial cell has junction and it is supported by the food process of the astrocyte. Okay, that forms the blood-brain barrier. Where the blood-brain barrier is absent? Blood-brain barrier is absent in the pineal body area and also in the neurohypophysis area, posterior pituitary area. Okay, we have to know what is blood-brain barrier, where it is absent. What is the purpose of blood-brain barrier? We must know that part. Okay, then what are the functional component of limbic system? Suppose olfactory bulb, hypothalamus. We have the mammillary body, very important. Mammillary body is a part of the hypothalamus. Mammillary body, what is the purpose of mammillary body? Small mammillary body. It is associated with memory. So an alcoholic person lose the mammillary body, they have dementia. Okay, they have dementia. So mammillary body is important. Also hippocampus in the temporal lobe, that is also associated with memory. Okay, especially the dentate gyrus. Okay, very good. We have done that. Then functional area, we must know the motor speech area of Broca. What is the area number? 44, 45. Then we'll go to the superior temporal gyrus. What is the functional area there? Auditory area. We have also the 41, 42 auditory area. We have just posteriorly we'll get the Wernicke speech area, area 22. Okay, so speech area, motor speech area is 44, 45. We have the Wernicke or Wernicke speech area at the posterior part of the superior temporal gyrus. That is the area, that area associated with comprehension. What is the terminology for lack of ability to speak? We call it aphasia. Aphasia. Okay, motor aphasia. Why? If there is any lack of blood supply to the motor speech area of Broca, what artery supplies here? That is the middle cerebral artery. Middle cerebral artery is a branch of what? Middle cerebral artery is a branch of the internal carotid artery. Internal carotid artery, we know that coming from the common carotid artery. Okay, very good. We have done that part. Okay, then this is the cerebellum. Okay, you are looking some type of branching pattern here, white like this. We have also folia here. We have no sulci gyri here, but we have folia here, and the card section, the junction between these two is the vermis, superiorly, inferiorly a gap, we call it vallicula. Okay, so we'll get the arbor vitae, this branching, white branching like the arbor vitae, that is the tree of the life. Okay, cerebellum, what is the purpose of cerebellum? Cerebellum regulates the movement of our body. What type of movement? Movement like that of the movement towards the right direction, right extent, right foots. What are the features of cerebellar dysfunction? Person has problem in posture, cerebellar ataxia. Okay, they cannot touch the nose, finger to nose test will be failed. They will have heel to shin test will be positive. They cannot pass the heel towards the shin of another leg. Okay, they cannot do alternate movement. There is a problem, we call it dysdiadokinesis. Okay, so these are the features of cerebellar dysfunction. Now, what is the blood supply of cerebellum? Superior cerebellar artery, anterior inferior cerebellar artery, posterior cerebellar artery. We will find out that what is the blood supply of the cerebellum. Then, what are the nucleus of the cerebellum? How can you remember the nucleus of the cerebellum? Easy way to remember, DEFG, dentate nucleus, emboliform nucleus, vestigial nucleus, and the globus nucleus. And remember, cerebellar function is ipsilateral, not contralateral, same side control. Okay, we got that. Okay, then we'll get few questions like that of the motor area. You have to show it the precentral gyrus, postcentral gyrus. I cannot show you from this side. Okay, like that of the motor area and the sensory area. Okay, we have to go through that part. Then what you need to know, few things. If your cerebral aqueduct is blocked, what will happen to you? You will develop hydrocephalus. If the arachnoid villi is blocked, you will also get hydrocephalus. That will called communicating hydrocephalus. If the cerebral aqueduct is blocked, we call it non-communicating hydrocephalus. Okay, we got that. Okay, so and that's all about the brain today. First day we'll go in details. Next day if we can manage time. So I thank you, Dr. Sobhuj, for arranging this thing, and also my son who helped me to set up the computer. So I like to conclude today's presentation now. I wish everyone should have a very good day and stay safe and healthy. Okay, bye now. If you have any question, you can write the question now. I can answer. Okay. Okay, so thank you very much. We'll meet again if I have any chance. If I have chance and Dr. Shobuz can manage the time for you also. So any convenient time, both you and me, we may meet once a week or once a month, depending on your demand. Okay. So thank you. I wish again good luck to everyone. Stay safe. Okay. So bye now.